Action protocol during an epileptic seizure.
Before the ictal testing, we should check safety. In case of sudden movements, ensure that the patient is not injured. Video. The camera should be focused on the patient. No one should be between the camera and the patient. There is enough light. The patient is not covered by sheets.
Beginning of the test.
Wow, it looks like the patient is having a seizure. Steps to follow. 1. Remain calm. 2. Inspect the patient. Yell into the audio if you see eye deviation, minimal twitching, piloerection, facial flushing, pallor, which are discrete and usually cannot be observed on the video. 3. Check the patient's safety. In case of generalized seizures, if necessary, place the patient in a safe position, lateral cubitus or lateralize the head, without forcing the posture. In case of focal seizures, with disorientation and confusion, reassure the patient and prevent him from hurting himself by moving. Remember not to introduce any object in the patient's mouth. 4. Monitor time, for example, by timing. 5. Neurological examination. 6. Monitor vital signs. 7. Cannulate peripheral venous line.
If deemed necessary, the nurse will ask another person to assist in the monitoring of vital signs and cannulation of the line while performing the examination. Responsiveness. The nurse calls the patient by name.
John. John.
When he does not respond, the nurse touches his arm. If the patient were to respond, we would have to ask him what he is noticing. Speech comprehension and ictal palsy.
Raise your arms.
When the patient does not react, the nurse raises his arms for him to imitate.
Can you raise your arms like me?
Verbal function.
Repeat and remember the following words. Red dog. Can you repeat what I just said?
Orientation.
What is your name? Where are you? What is the date today? What day of the week?
Verbal memory.
Do you remember the words I have said to you? And the movements I have asked you to repeat?
Anomia and visual memory.
What is this?
Since he can't tell her the name, the nurse keeps asking him questions.
Could you show me how to use it?
The nurse asks him to remember the object she has shown him.
Remember this object.
Other cognitive functions.
Can you count from 1 to 10?
Since the patient is over 6 years old, we could also ask him to read or write.
Does he remember the object I showed you before?
If he doesn't remember it, as it is the case, he is shown 3 objects, one of them being the one shown earlier.
Does he remember which of these objects I showed you before?
Postictal exploration.
Have you had a seizure?
Yes, I think I have had a crisis.
What is the first thing you felt or noticed?
A strange feeling in the stomach.
Do you remember the words I said to you? And the movements I asked you to repeat? And the object I showed you?
No, I don't remember anything.
Can you lift your arms and legs? Can you raise your arms as I have done? Do you know what this is and what it is for?
It's a pen and it's for writing.
Can you tell me your name?
My name is John.
How are you feeling?
I feel fine.
Do you know what day it is today and where we are?
Today is Monday and I think I'm in the hospital.
Continue with tests until the patient has fully recovered. If the seizure does not resolve in 2 minutes, notify the specialist doctor.